For very substantive remarks in the beginning, and I also must thank Professor Ajay Dubey for very exhaustive presentation. Not much is left for me to add, but let me make an effort. I have put a PowerPoint together, which I shared with the webmasters, so probably it would be here on our screens. As I see the evolving needs and I think the dimensions of our engagements, they are diverse. And I think Ambassador Chinoy has raised a very pertinent point whether we deal with all of 54 countries at the bilateral level, or do we deal with regional groupings, or we make some choices. In my view, I think given the fact that the market would be getting integrated, the idea of continent-wide free trade agreement is an effort by the African Union and the community to have their own sort of free trade agreement in force from July onwards. I think it's pertinent on our part to see that the larger dimensions of our engagement are addressed, and that I think would bring in the questions of how do we move forward. I thought that there are sort of 4 points which we can look into before we actually start this discussion today. First and foremost is India's own experience in managing COVID crisis, and I think this is of key significance for us to get that document what different dimensions of our crisis management we have addressed, and I thought I would bring that up in few slides, and then would try to see how the complementarities for cooperation are, and from that point of view, I can derive some lessons in terms of going forward. So can we have the first slide, Piyush? Yes, this is largely the kind of issues we would be covering. So next one. Yeah, if you look at the mega challenges that we have here, the morbidity rates are not extremely high. And fortunately, Africa as a whole, as Ambassador Chinoy pointed out and Professor Dubey also alluded to it, is pretty on lower side given the larger global sort of challenges that we have. Next. I have tried to put together the numbers that that were available. Unfortunately, Africa has floated a dashboard where you are getting real-time numbers. So today at 1 o'clock, this was the number this afternoon, and we have taken out these numbers. As you see, unlike in the beginning where the concentration was very high in the northern Africa. Now you see that it is spreading across the continent, and concentrations are more where external orientation of the economies are larger. And that's where you see South Africa and Egypt bearing the most of the burden here. And that, I think, is what is coming out from this graph. Next, please. This is India's own experience, and here the black is the line that shows deaths, and as you would see, the losses are minimized in India. So we need to understand what has actually happened, as we all have seen this history making in front of our eyes. But I thought it would be pertinent to bring them here as we evolve templates for our cooperation with other countries. Next, please. Here, the COVID crisis in Africa, I think Ambassador Chinoy very rightly mentioned that Lesotho and Comoros are the two cases, and indeed that is still the case this afternoon when I checked the dashboard. The countries that have reported the cases are 52, but recoveries are not that bad. They are equally high, and as I said, the morbidity with the virus is minimized by Africa as well. So this is something which is very encouraging, and I think some sort of crisis management has already been initiated by the continent. Next. Now, let me quickly go through some Indian experience, and I will just quickly run through these slides. There are some, of course, peculiar distinctions that we have: the size, the population, the immense diversity, the vibrant and pluralistic society that we have, the trust in government and governance systems, and of course, the ecosystem pertaining to science, technology, innovation, but also pharmaceuticals, biomedical, and information technology. So all this provides the necessary STI ecosystem in the country. Next, please. I would say that the initial action by the government that I think was something that could help us initiate and act in time, and that as Prime Minister has been continuously articulating from different platforms. The idea has been with the centrality of citizens, and we could put a very integrated framework right up front, whether to have health infrastructure or ensuring medical supplies or bringing in the bands that are required, managing the administrative architecture for the whole initiative. As has emerged, Prime Minister himself has been at the center. And then when we say citizen-led crisis management, the civil society, the health workers, the science, technology, innovations, the media, Prime Minister talking to all the different actors, be that chief ministers or heads of villages or the media, the radio jockeys and anchors. The idea and the message has largely been in terms of the Ministry of Health led sort of processes where the inputs from the experts and the leadership by the Prime Minister, I think, has played an important role. And this all I have tried to couch within the framework of effective communication. And that, I think, is crux. So when we evolve our templates for cooperation with the partner countries, this is something that we should put right up front in terms of catalyzing the processes of this nature. Next. And this, I think, is evident in terms of how the leveraging of technology has happened. All of us have Arogya Setu on our apps, and I think that is important. The e-Gram Swaraj portal is another one that is launched on 24th of April. So that, I think, also largely captures the issues which are of great significance in this effective communication strategy. This is, I think, further supplemented by state governments and nudging them a bit to see how their own packages are coming in, how from January till April the sustenance of the efforts by administration is required, and to what extent these packages are dovetailing the efforts we are making through digital economy, identifying the right beneficiaries, minimizing the leakages, and providing the direct benefit transfers that are of significance. Here, I think other African countries would also have to see, since they also have huge MSME networks, how the informal economy and MSME can get advantage when we are talking about loss of livelihood security, when we are talking of lives and livelihoods, what kind of issues are coming up and in what way we benefit farmers, we identify microfinance, ensure food security, and ensure that the banks connect. And that's where the role of the fiscal policy and monetary policy together come in, I think, in a very important manner. Next. So there, the issue is how do we address global norms? And India's Reserve Bank of India has given a very clear message by and not blindly following global norms. I think the 17th April press conference by the Governor Reserve Bank was very clear in terms of India going beyond commitments to Basel III norms. And that's what I think we need to share with African countries, that WHO, India is working closely with, but it is not that all the advice of WHO we are accepting. And that's what applies to finance and economy as well. We need not be blind for our commitment to Basel III norms and other global commitments. And this gives the maneuvering space to state. And that, I think, is a very important message that we should communicate through our own experience and our own results that we are getting. And this is largely in terms of the definition of NPA. Why in a developing country, 90th day should be the day for NPA. Unfortunately, earlier RBI followed in 12, 13, 14, but gradually we have come out of that norm, and 17th April was a watershed in terms of coming out with our own approach, and that I think is very, very important. Next slide, please. And this is Arogya Setu I have already talked about, but many state governments are using drones, they are using GIS system, and also for tracking are using big data mining of the mobile data that they are getting. And this is largely in terms of how the Bluetooth and GPS devices are to be used for tracking. And that I think is extremely important for several state governments where density of population is very high. And then I cannot say that all citizens are irresponsible, but quite a few of them haven't shown the sense of responsibility that is needed. So how from technology you can use a bit of nudging, you can spot them and you can put them back in the expected places where protection and safety of everyone is ensured. Next. This is what I think is another Indian experience with 1.3 billion people, that we could identify hotspots. And if you see a number of districts that are there, India has around 736 districts, and out of that, 170 districts in 20 states and 5 union territories are in red zone. So hotspots, as I have put here, are the hotspots. And then you have 207 districts in orange, which is marked here in yellow. And then is the green zone with the 359. So when we are planning exit strategy, I think it is equally important with Africa to share what the exit plan should be and how do we come out of lockdown, as India is also exploring. But this is, I think, the mantra here is TTIQ, test, track, isolate, and quarantine. And this, I think, has played an extremely important role in moving forward. Next slide, please. And this is, I think, largely through seamless convergence. And I think 4 major points here in terms of seamless convergence in next 2-3 slides is that first and foremost is to do away with our paranoia with international commitments. Second, bring public and private partnership together. Many private hospitals have been leveraged. So that false distinction that Washington consensus has imposed on several states in Africa, I think we have to encourage African countries to come out of that mindset of distinguishing between public and private. So all have come together. Third and important is to create parallel with the allopathic systems so that the traditional medicine system and African countries have strong connect. And fortunately, Ayush Ministry is in touch with Africa. So that I think is extremely important in terms of how Indian government is approaching with the Ayush sector here. Agriculture and our own migration, if you look at urbanization in Africa, the story is not very different from Africa and from India. In fact, 2017, there was a major UN report, UNDP report on development experience of the urbanization. And it brought out clearly that there is huge migration in urban areas. And if reverse migration starts in 12 cities of Africa that have been identified by the African Union, many of our own experiences would be very handy for them. Next slide, please. Next slide, please. And this is, I think, the Ayush dimension that I have already talked about, the immunity building and other formulations that are of significance. Next slide. I'm running out of my time, so can you please fast? Some pre-existing initiatives of India probably would be extremely important. And Ambassador Chinoy, I feel that when we share our COVID experience, we should also build on our earlier experience, like the Aadhaar-linked e-payment services, the idea of people-centric development, but also bringing in this traditional knowledge, Startup India. So now, out of 13 ICMR recognized test kit suppliers, four are startups that are providing this. So I think this is extremely important dimension of our engagement and creating digital payment platform. Or in 2017, we launched the National Biopharma Mission. Our ICMR and Africa, when Dr. Bhan was there, had already initiated. Fortunately, I was part of that initiative with Africa in 2017. So we have seen how biotechnology is closely connected with African countries. Next slide. Already, Professor Dubey has elaborated at length, so I would not get into it. PM has already spoken to quite a few of our partners from Africa. Next. Care beyond borders is a unique, I would say, way we can describe our initiative. Both Ambassador Chinoy and Professor Dubey have captured what has been shared, but I think it is important to emphasize here the need for everyone to contribute. And Prime Minister's leadership in the region in South Asia is an example for other countries to see how big countries can provide a sort of model for everyone. India gave 10 million, but others have also generously supported according to their capacity. And in South Asia, we could create a fund of 18.3 million. So no need to depend on anyone. Local resource mobilization is the best strategy for the countries to match, and do not wait for ODA or development assistance to come in. Next slide, please. Next slide. Next. Yeah. So Africa, Brazil, all countries have profusely thanked India for cooperation. Next slide. Next. Yes. So here a couple of countries where we have already reached out, almost 50 countries we have reached out to in terms of our assistance. Next slide. Yes, and this is what I wanted to emphasize, Ambassador Chinoy. The import dependency for health sector is huge, and India should extend a cooperative sort of endeavors, not only for trade but also for local production, encouraging our firms to produce medical devices, pharmaceutical products, taking advantage of our trade and investment linkages with Africa. And if you see countries after countries, all the 52 countries that are affected by COVID are hugely dependent. At RIS, we have churned out a huge data to come up with this observation. Next slide. Next slide. Yeah. Next slide, please. Next. Yeah. Next. Yeah. Here, this I think is important, and yeah, this one. And here I would close. If you look at health sector, there are four areas which are dependent on others, like for instance, agriculture, digital technologies, and development practices. In health sector, digitalization, the personal protection gears that are required, medical devices, API supply chain, vaccine development platforms, training of paramedicals, which I think Dr. Shetty very rightly emphasized, and Ambassador Chinoy alluded to that, developing domestic biotechnology capacities. I think these are the areas which I think are extremely important, and they dovetail with the SDG commitments from nutritional food security point of view, from digital technology perspective, and also development practices. And here as you would see, Ambassador Chinoy, the last column talks about the convergence of the fiscal and monetary policy, maintaining adequate liquidity, new norms for credit rating, and financing from small and medium enterprises. Next slide, please. And this is, I think, important, as RIS has initiated this establishment of Global Development Center, where we are tracking development initiatives by all the 54 African countries and trying to see where the scope for them to learn from India is, and we are right now in the process of benchmarking Indian COVID management strategies for Africa. So I would stop here. Ambassador Chinoy, thanks for giving me additional time and for your patience. Thank you.